Hello again. It's Chief Ron Berry of the South Brownsville Fire Department. And today with me is one of my interior firefighters who's also an EMT, Phil Thomas. Hi, Phil.
Hi, Chief.
You notice Phil has a New York roof hook in his hand. That is a 6-foot hook. And the reason we have that out is we want to show you about social distancing. So if you want to hand me one end of that, Phil. Okay. So this is 6 feet. Okay, this is the recommended minimum distance for social distancing. Notice that we're practicing that. So, I don't know too many people who carry one of these around with them, but this will give you an idea of how far you should stay apart from others to maintain social distancing. Okay? So, in the previous episode, you heard me talk about how the fire department's been affected by COVID-19 and the pandemic. So today we're going to talk to Phil, since he is a full-time EMT, about how it's affected EMS. So Phil, have you noticed an increase in the number of calls that are related to possible COVID-19?
Oh, absolutely. Our call volume has probably increased maybe 20, 25 plus more calls. And it's very tough because there's certain precautions we have to take now. We have to still maintain social distancing of 6 feet. We have to ask all of our patients now whether they're showing signs and symptoms or not. If they've been out of the country for the last 2 weeks, if they've had cough, shortness of breath, fever. And they update the protocols every day to that the symptoms change. It seems like every shift we get on, it's more symptoms follow. And it's just more questions, it's just more symptoms. It can be very confusing to tell if they're showing signs and symptoms of COVID-19 or if they just have bad allergies.
It seems like it's a very dynamic situation because it's fluid, you're right, it does change. The Pennsylvania Department of Health, Bureau of EMS, they've modified the protocols for COVID-19, and most 911 centers, I would probably say all 911 centers. I know, you work for Fayette and Brownsville, and Brownsville, of course, covers Washington County and Fayette County. And in our active 911s, I noticed that they screen all callers for COVID-19. They ask if they've been out of the country, they've asked if they're experiencing any fever, cough, etc. And now, at least in what I've heard from some of the dispatches, we're starting to get some calls for people who actually have tested positive. So, the number of cases here, just like it is everywhere else, is increasing. So Phil, what is the standard issue personal protective equipment that you're to wear when in contact with a COVID-19 patient or a possible COVID-19 patient?
Well, at first it was just simple, just whenever this all first started, it was N95, respirator mask, gloves, obviously goggles or protective sunglasses, but then they changed it. We are to now have a full gown, full bodysuit, whatever we have, still with gloves, N95 mask, and now safety goggles. And if we have long hair, females or males, we have to wear like a beanie cap, like a shower cap sort of.
I noticed that, a lot of friends in EMS, a lot of men in EMS have beards, and unfortunately those beards had to go because they interfered with the seal on the N95. Is that correct?
It is.
I know you had a beard.
I did.
You shaved it. Good thing is it'll grow back once this is all over. But have you come into contact? I've been asking, if you've had any definite COVID-19s, but have you had any patients where you've suspected?
Me personally, no. We haven't. I've been lucky not to have one yet. Most of the calls I've had, it's just been chest pains or just flu-like symptoms, but they tested negative. It was nothing major, but a lot of my close friends that I do work with, they've come in contact with a lot of them. And a few of them have been exposed. I had a couple get exposed to it, but they seem to be okay. They're healing. They said it's a slow process. It's a tough bug to kick, but they're fighting through. They're hanging in there.
In knowing the EMS professionals in this area like I do, I'm fortunate enough to have trained some of them, including Phil. I know that they're up to the challenge. I know that even though they didn't ask for this pandemic, they're not going anywhere. They're ready for it. That's what they're made for. That's what they're here for, and they will deal with it. So, you know, as I said in the previous installment, a lot of times in emergency services, firefighters and police officers get the majority of the credit. Where EMS, and I got to give a shout out to 911 too, because, you know, my sister's a supervisor at Fayette 911, and if I didn't do that, she'd never forgive me. But they're on the front lines of this too. I mean, they're taking the calls, they are screening the patients as best they can if the patients are even willing to tell them, or the caller's willing to tell them. So the information they pass on to responding emergency services is crucial. So shout out to them as well. And the folks at emergency management, who are dealing with this on a county-wide level. Shout out to them too, because they're doing really good things. But, you know, your EMS professionals, and not, you know, they're going to see it before anybody else does. They're going to see the symptoms, they're going to be exposed to it before anyone in the hospital setting is in most cases. And we'd also caution you too to you know, monitor yourself. Phil, what are some of the other signs and symptoms that they should look out for?
Let's see, there's, what is it, fever, what, 100.4?
Something like
So
that.
it's like a fever, 100.4, any shortness of breath, dry cough. I think they added diarrhea to the list. Especially, there's a bunch of them now, they updated it like 12
Yeah,
times.
and again, you know, the Department of Health, PA Department of Health, Dr. Levine, and the CDC, World Health, they update it constantly. And again, this is new to everybody, so this is a constantly changing and evolving situation. And so your EMS folks and your healthcare folks are doing their best to stay on top of it and try to stay ahead of it as best they can. But here in Pennsylvania, I think you know, the worst is yet to come. And you know, so say a prayer for everybody who works in healthcare who's exposed to this or potentially exposed to it. They're going to get through it, and I think it's going to be their finest hour. And I think they're going to set the standard for the world to follow. You know, how to best respond to this pandemic from an EMS and healthcare level. So remember, folks, follow the CDC guidelines, maintain your social distancing.
Wash your
Okay.
hands.
6 feet. Okay. All right, at least. Okay, wash your hands constantly. Matter of fact, as soon as we're done, that's exactly what we're going to do. That's just soot from the pipe bowl.
Yep.
Okay. Well, that's the first thing we're going to do. When you go out in public, wear a mask if you have one. Doesn't have to be an N95. You know, a fabric or cloth mask will do. And stay home, stay safe, stay calm. And remember, we're here for you. And another word of advice, simple flu-like symptoms, fever, cough, things like that, is not usually a reason to call 911. We would recommend calling your doctor first. If you're having shortness of breath, by all means, call EMS. But regular flu-like symptoms, you don't want to overwhelm the EMS system that's already spread thin to begin with. You know, even before the pandemic, EMS is spread pretty thin, so resources are limited. So, you know, if you have any of those symptoms, you know, if at all possible, call your doctor first and see what he or she recommends, and then go from there. So, you know, we pray that all of you watching this stay safe. Phil, any last words to add?
No, I think we covered them. Elizabeth, just like Ron said, stay safe, wash your hands, stay home. That's probably one of the biggest things, is staying home. But no, I think...
And the only reason that we're not home is because we had to do a little bit of maintenance to some of the rigs to make sure they're ready to go in case of an emergency. But as soon as we're done, we're going to be rolling out of here and heading home like everybody else. So thank you to Chad Dolan, Fire Dog Productions, for his videography. And God bless you all, and take care.
Stay safe.